do about 5 more minutes, everybody. Relax. I'm sorry.
Mic check, 1, 2.
I don't know, but I came upon a video created by a deaf man who had looked at the virus and determined that was the sign and publicized it.
Kind of looks like a chicken.
What is the sign for?
This,
Just out of curiosity, what's the sign for church?
So much for social.
It looks like a church.
church.
Okay.
There are some people that use it.
Okay.
And they were all right down in the elevator together.
Yeah.
It's a good thing we're not overseas, Brandon.
Yeah, right. Ryan? Tomorrow's the last day of the session.
afternoon, all. Microphone on here, Tommy? Great. Just give us a minute. Good afternoon, everyone. Thank you all for being here this afternoon on short notice. We appreciate that. Clearly, we are here today to talk about COVID-19. I think all of you know that. And in the city of St. Louis, in the region here, but even more importantly, across the country and across the world. I'd like to take a minute, if I could, just to have everyone here introduce themselves. This is the team that has been working on this continuously, more lately than previously, to address our response to COVID-19. So, Frank, can you start?
I'm Frank Oswald. I'm the city's building commissioner.
Christina Davis, Health Service Administrator for the City Jails.
Nathan Graves, I'm the Circuit Court Administrator.
Dennis Jangerson, St. Louis City Fire Chief.
Rex Burleson, Chief of the 22nd Judicial Circuit Court.
John Hayden, Chief of Police.
Fred Uckles, Director of Health.
Tim Gardner, Circuit Attorney, City of St. Louis.
Jimmy Edwards, Director of Public Safety.
Newton McCoy, Administrative Judge at City Courts.
Richard Torak, City Court Administrator.
Gary Hirschman, Commissioner of Emergency Management for City of St. Louis.
Michael Brown, Deputy Superintendent, St. Louis Public Schools.
Lori Willis, Deputy Superintendent, St. Louis Public Schools.
Richard?
Richard Torak, St. Louis City Court
Did you
Administrator.
already do that? I'm sorry.
Okay.
All right. Sorry. Thank you all for being here. As I mentioned a minute ago, we are here today to talk about the rapid spread of COVID-19 and what the city of St. Louis is doing about that right now in order to fight it. At this time, we do only have one confirmed case. It's in St. Louis County. The city of St. Louis doesn't have any confirmed cases, but what we know from other countries and from other areas of our own country is that this virus has been spreading very rapidly. The World Health Organization, as you know, declared COVID-19 as a global pandemic. Already in the city of St. Louis and in the region, we have seen many cancellations. Of course, many sporting events, NCAA, hockey, Major League Baseball has postponed. Conventions have canceled. Most large gatherings have canceled their events at this time. It's unknown for how long that will be, but that is where we are today. It's a very evolving situation. It has evolved just since yesterday and the day before that. So those cancellations are it for the immediate future. I do want to say that the vast majority of the colleges and universities in our area have taken some very strong measures. You know that one university has canceled the rest of the semester, at least for on-campus classes. Most universities have canceled in-person classes. We have taken a number of preventative measures here in the city to slow the spread of COVID-19 to the extent that it is here. And of course, we don't know that extent because testing has been limited. But we feel like we have to take these measures anyway in order to prevent that spread. This morning, some of you may have seen that I directed the water department not to do any water shutoffs for either residential or commercial properties for the next 60 days till May the 15th. I did that because obviously one of the things that's being said over and over is wash your hands, use good hygiene, clean your surfaces. Well, you've got to have water in order to be able to do that. So we did that this morning. there won't be any water shut-offs. That doesn't mean you don't have to pay your water bill. It means that your water will not be shut off for the next 60 days. And of course, we'll evaluate all these timeframes as we go along. We have also placed hand washing stations throughout the area of downtown. Some of them are even being delivered probably as we speak. These are soap and water hand washing stations for anybody who might not have access to sink and soap and water so that they can do that downtown. Those are being placed as we speak. We've enacted the Unified Health Command to ensure the timely sharing of information. This is across, I believe it is 18 jurisdictions here, so that has been stood up. We have communicated with our city employees just about an hour ago maybe. City employees all received an email that talked to them about how to prevent, talked to them about what to do if they feel that they have been exposed and are symptomatic, and who to contact, which would of course be their medical doctor. If they don't have a medical doctor, it would be to contact the city health department, and so that we can determine if they need testing and provide for that situation. We know that this virus disproportionately affects older people, and so I would say to you, reach out to your older neighbors, family members, friends, to try to give them the information that they need in order to not be afraid. Couple of other things I wanted to mention to you. On Election Day, I think you know, we provided hand sanitizer to all the polling places. That turned out to be a very welcome thing in some polling places that might not have otherwise had it, and that was just as a preventative tool. I mentioned the water department won't be shutting off water. The other thing that I announced today in the message to employees is that anyone who does have to be voluntarily quarantined, in other words, they've been directed by their doctor or our health director to quarantine, and that would happen as a result of potential exposure and symptoms. If they've been directed to quarantine, the city will pay them for the days that they're quarantined without them having to use their sick time. We don't expect that will be a lot of people. We certainly hope it's not a lot of people. That's why we're putting these measures in place. But to the extent that someone has been quarantined, that means stay at home. You, all your family members, whoever is in your household, stay at home. Don't go to church. Don't go to the grocery store. Don't go out of your house. Those folks would be paid for that time off. There are a lot of other people here who have a lot of information, and I want to let them speak, certainly. And I think the first person who ought to speak here is Dr. Fred Eccles. We are very pleased to have Dr. Eccles as the head of our health department. Some of you may know this, but it's been about a dozen years, give or take, since the city of St. Louis has had a medical doctor in charge of our health department. And I'm going to just tell you right now, I consider that a stroke of luck, maybe not a stroke of genius, but we are so pleased that he is here. So I'm going to turn this over to Dr. Eccles. A few other people will also speak, and then, of course, we'll take your questions. Dr. Eccles?
All right, thank you, Mayor, for those remarks. As you mentioned, we're really monitoring this situation very closely. As everyone knows, there's community spread in other areas of the United States, and so it's really not a question of if, but when we have a case in the city of St. Louis. And we're working diligently across sectors, across the region, to make sure we're properly prepared. As you can see here, we have a lot of stakeholders that are engaged and involved in our response. And it's really important for everyone to know that although they may not see efforts being out in public, there's a lot of work being done behind the scenes. We're working really closely, not only with these stakeholders, but also academic institutions, community-based organizations, also private industry individuals, organizations, to make sure, again, that we have the resources we need to provide a proper response in the event that a case is detected in the city of St. Louis. Within the health department, we have several components of several programs within the department that are also playing a critical role in this response. One is our communicable disease control program. So they're the ones that are responsible for making sure individuals that have that report being exposed to a confirmed case or report being traveling to in areas where there's ongoing transmission. We make sure that they are properly monitored according to guidelines that have been established by the Centers for Disease Control and Prevention. In addition to that, we also have our emergency preparedness program staff who are really engaged in working with our stakeholders, particularly non-traditional stakeholders that haven't been engaged by the health department before. So city venues, other community-based organizations and academic institutions. Again, we're working with them really closely to make sure they have the information they need. We're also taking the time to inquire about their readiness, so whether or not they have emergency operation plans in place. If they don't, we're assisting them with actually developing those plans and actually reviewing them. If they do have plans in place, we're reviewing those plans, addressing any identified areas of improvement, and working with them to make sure their plans are up to date and meet national standards. We have a group of stakeholders. Again, we have communication is a really important piece of our response. So there's a lot of misinformation that's circulating, social media, the web, TV, et cetera. So we're working really closely with all media outlets across the St. Louis region to make sure accurate information is available to not only laypersons in the community, but also medical providers, academic institutions as well. And this is important because there's specific guidance that has been issued by the Centers for Disease Control for businesses, academic institutions, including primary, secondary, and tertiary institutions, as well as government agencies. And so we want to make sure everyone in the city of St. Louis has accurate information at their fingertips. And so what we've done is we've posted this information on the City of St. Louis Department of Health's website. This information, again, is ready, available 24/7, and it reflects, it links individuals to the most current information that's been published by the Centers for Disease Control and Prevention. Furthermore, one of the things that we're also responsible for, again, is making sure we limit, prevent the spread of COVID-19 when we do get a case in the city of St. Louis. And so one way to do that is really to limit the size of gatherings in our jurisdiction. So today, as the director of the Department of Health for the city of St. Louis, and under my emergency powers, I declare that any event in excess of 1,000 people shall be prohibited with the exception of religious services until further notice. And this does not include day-to-day operations such as schools, academic institutions, et cetera, but any event in the excess of 1,000 people strictly prohibited until further notice. And I'll turn it back over to the mayor.
Judge Edwards.
The hope here is to help stem the spread of COVID-19 and to implement precautions in furtherance of public health and public safety. As a result of that, we have our police department, our fire department, paramedics, EMS, all prepared to proceed in a safe manner. Additionally, we have our court partners. We have our circuit attorney, as well as the presiding judge of the circuit court. We have our city court presiding judge here to address issues as it relates to court and jurors, as well as the general public. Also present is a member of Horizon, which is our medical staff inside of corrections. We have ensured that we have made the medical unit within our jails ready to address any situation involving influenza and or COVID. We have also had a conversation with the state public defender, Mary Fox, with respect to how our detainees inside of our jails will communicate outside. We have limited visits inside of our facility to 2 days a week instead of 7 days a week. There will be no contact visits within our facility except for attorney-client visits. We've had conversations with the public schools, with Dr. Adams, and members of the St. Louis Public School staff are here if there are questions with respect to students within the public schools. I last talked to Dr. Adams last night with respect to spring break. Spring break is next week with respect to children within the public schools. And we understand that should spring break is extended, there will be accommodations made for children in terms of feeding them and in terms of keeping them safe. We are constrained by law under the HIPAA rules and other statutes with respect to the privacy of many individuals under the Public Safety Department. We will maintain their privacies. We will do our jobs within the boundaries of the law. Thank you.
Judge Burrows?
Well, just briefly, as far as the 22nd Judicial Circuit, we've been in contact the last 10 days with a number of the agencies. About all that I need to say as far as the courts, there's 3 different categories of people that I need to talk about. The first are the jurors. It'll be business as usual until we're told that business will be modified. On your jury summons, you have a phone number that will get you to a recorded message. The jury supervisor can be called directly to get a live voice. Essentially, we are going to interview everyone who comes in the courtroom or courthouse Monday for jury duty, talk to them about the possibility of them having symptoms as recognized by the Center of Disease Control, and if they do, we're going to send them home. Those that's past that stage, we are going to seclude them in various areas of the courthouse with 6-foot intervals, and to keep them so we can have enough jurors to keep business going. We're going to reprioritize the cases so that the higher end cases will get the jurors, and we'll try to keep that area of the business moving. The second area are the lawyers. The lawyers should be in touch with their clients. Anyone who has any symptoms, our focus is going to be the reduction of exposure, so we'll be continuing cases. Just all we need is that information from the attorneys. And witnesses, if you're under subpoena, call the attorney who has subpoenaed you and find out, or tell that attorney if you have a symptom or a reason not to appear in court, and we'll be very liberal in rescheduling those cases and those appearances in order to minimize the congregation of people. We have also asked our court administrator to fund additional janitorial services. We expect to have all floors of the courtrooms on both sides of the Market Street wiped down 2 times per day. We will have other hand washings, and we will have staff that we're asking to be very diligent in talking to people about any symptoms that they may see that person is experiencing. Thanks for the opportunity.
Thank you. Thank you. Circuit Attorney Kim Gardner.
Just want to thank you for being here because, as you know, this is serious. And to be the circuit attorney, but also to be a registered nurse, I want to thank Dr. Eccles for giving us the tools to be educated, and the mayor for allowing us to be here to work together with the police chief and law enforcement and former Judge Jimmy Edwards and the court personnel, because it's key to prevent any exposure from the public as well as our lawyers, but to maintain due process and safety for everyone inside the courtrooms, for judges, court personnel. So we're looking forward to working with each and every partner up here and other partners in the community for education purposes of how do we address exposure, prevention, but at the same time, how do we address education, because there's a lot of miseducation going out in the public, as well as how we keep the courts going and, like the judge says, due process of cases. And it's about fairness, safety for everyone, victims, witnesses, and law enforcement, which we don't get a day off. And so we want to make sure we have a plan for first responders that is appropriate when they're sick, how we keep them the day-to-day working and moving, which we look forward to having a more comprehensive plan and working together. So thank you.
Thank you. We're going to hear from Fire Chief Dennis Jenkerson now, who of course is Fire Department and EMS, so a very important component.
Thank you, Mayor. First off, I want to start to remind everybody just to stay calm. The city is prepared for this. We've been through different viruses before. The fire department, the EMS department, we've been through this. We started active surveillance on January 24th on the fire department side when we were receiving the calls from people who were worried about it. So we've been dealing with it for a while. So far, everybody has remained calm. What I want to tell you is we've changed a few of our protocols, mostly how we react when people call. You know, we're not going to rush into the home and touch somebody to feel how warm they are. We do keep our distance. We're checking on them. More importantly, before we get to the house, you're going to be asked several questions over the phone using an active surveillance tool that we have. And we bring the people through the different questions, trying to decide at what risk they're at and at what risk we're at. Okay? We're receiving about 8 to 10 calls a day with primarily people who have the flu, but they are still concerned with what they have. So, like I said before, just remain calm. If you have questions, you can go to any website, to the CDC website, and those questions will be answered. If you are still concerned, you can call 911, and we'll walk you through the program. We only have one confirmed case, as the mayor said. It's in the county. Right now, the City of St. Louis Fire and EMS Department, we are prepared. Our supplies are where they should be. We have no issue at this time. So I'm very confident that with all the department heads and everything that's going on right now, we will get through this.
Chief Hayden?
I just want to assure the public that all of our response protocols are the same, so we have not changed how we respond to calls. Of course, our officers are equipped with personal protective equipment that includes eyewear, respirators, and gloves. But at the same time, we are full on with respect to our response to calls. At this point, we are responding to all calls as we've always have.
Okay, I just want to close by saying that this is a very challenging situation and a very fluid situation. What we know now is, and the decisions that we've made over the last day and a half are different than what we knew 3 days ago or 5 days ago or 7 days ago. So we will continue to make good decisions, keep you updated, keep the public updated as this situation progresses. The other thing I will say is that this is a pretty devastating situation for many of our businesses and for many of our workers. When you have large events that are canceled, we did not make that decision lightly, I will tell you. It was a very tough decision to make because we know the impact that it has on the people who then don't get the hours to go to work, or the folks who are not earning the living that they were, and on the businesses, both small and large. I mean, this runs the gamut from airlines, which are being very, very challenged by this situation. Our airport is down about 30% in terms of traffic, just number of people going through the airport, because as you know, folks are canceling trips. But that has a ripple effect through our entire community. So whether it's from the airport to the small coffee shop that is down the street from you, I would just say we do need to go ahead and live our lives, and we do need to, I said this at a neighborhood meeting a couple of nights ago. I was going out to eat after I left the neighborhood meeting, and I said, double tip your server if you can possibly afford it. Because these folks are depending on this income, and we know that through the cancellation of conventions and concerts and sporting events and all of those things have a huge impact on the thousands and thousands of people in our community who work in this hospitality, tourism venues. So keep that in mind as you go about your daily lives. Of course, city government is running. We are here. We're running here as usual. All of our offices will be open. and we don't expect that to change. I do want to say, and I should have said it earlier in my remarks, is that I am in regular conversations with County Executive Sam Page, as 5 minutes before we walked out here. He also has agreed that we should limit the size of large events. And we agreed that we'd limit that size to 1,000 at this point in time. Most of the large events are scheduled in the city of St. Louis. We have the larger venues. And so we just wanted to make sure that we were in sync on that. This is a unified effort in order to stop the spread. So I'll take any, someone here will take any.
We have a lot of speakers and a lot of reporters, so if we could do this in a somewhat orderly fashion. Kevin, you stood up first, so.
Well, thank you. A question perhaps for the mayor and Dr. Eccles. Given all these steps that you're taking, what are our chances of minimizing the impact, the number of people who get this in St. Louis? What do you think?
Well, we think all of these steps should minimize the impact. I don't think we know at this time what is the number, but we believe that this is out of an abundance of caution is how these decisions are being made. And they're difficult because as devastating it is for businesses and employees who work at those businesses, it would be very, very devastating to have many, many cases of COVID-19. So this is a bit of a choice.
It's also important to remind individuals in the community of those simple preventive measures that we keep reinforcing. So wash your hands regularly, stay home if you're sick to prevent exposing others to respiratory illness. Those simple measures have proven to be effective year in and year out. It's also important to remind individuals that the most common cause of respiratory illness during this time is the common cold and the flu. And so as Chief Jenkinson mentioned, don't be alarmed. We're monitoring the situation. As the situation evolves, we'll change our guidance. We'll also be in touch with CDC and the state to make sure the guidance that we're issuing out to our partners is current.
And if it gets to the next step, last question for me, where you have to have a quarantine household, in a city where the law is sometimes just a suggestion, how would you enforce quarantines in St. Louis?
So right now we do have quarantine protocols. So individuals that are being monitored under the city of St. Louis, they are voluntarily quarantining themselves. So we have had no issues with compliance to date, and we hope that will continue. Again, our communicable disease investigators are doing an amazing job educating the constituents across our communities on the importance of self-quarantining if that's required of them. And again, so far we haven't had any issues with compliance.
Who's next?
You call them a couple times a day, right?
Yes. So part of our protocol for monitoring, so individuals have to be monitored for a total of 14 days from the date of their last potential exposure. We're in touch with them twice a day to ask them about symptoms, ask them about temperatures, et cetera, to make so that we're, if anything changes, we can link them to the necessary resources.
Rebecca?
Thanks. You talked about the financial impacts for canceling these large events. But why is that so necessary? I know that we saw in Italy the overrun hospitals and the potential human costs for people who might need to go to the hospital. They don't have the virus and can't get into the hospital because they're overrun. If you could explain why it's so necessary to cancel these kinds of events.
So to minimize the potential exposures, that's oftentimes when you have a case, whether it's the flu or the common cold, because of the way it's transmitted, you're likely to have a larger outbreak, a larger cluster of individuals that become infected. And so to prevent that from happening in the city of St. Louis, this measure is absolutely necessary.
And then just one more question. Are you at all thinking about putting a moratorium on evictions?
So as the mayor mentioned, we're monitoring the situation every day, and so as the situation evolves and the need for guidance changes, we'll change accordingly.
Sarah?
It sounds like you're still only testing people who've had contact with someone who has a confirmed case or somebody who's been traveling to an affected area, but those testing restrictions, I'm sorry, they seem still very limited, and so how can you prevent this from spreading if you're not even testing everyone who might be sick?
Right, so there are additional options for individuals to get tested. So individuals that do not meet the CDC's criteria for testing can also receive testing through private laboratories such as LabCorp or Quest Diagnostics. So those resources are available. And it's important for us to really to limit the number of individuals that obtain testing through the state because they do have limited resources. So we need to make sure those individuals who are at the greatest risk for actually contracting COVID-19 receive those resources.
Follow.
So the federal government has just announced that they're going to give millions of dollars to Missouri. Do you have any idea how that might be spent in a local response?
And so we're in touch with our state agencies daily to make sure that we're up to speed on how they plan to allocate those funds. One program in particular, our Public Health Emergency Preparedness Program, is one of the programs that is being focused on or being targeted for this particular event because a lot of the resources that you are seeing are related to our emergency preparedness and our emergency preparedness program. And so we're, again, in touch with them daily. As funding becomes available, we'll be letting them know what our resource needs are to make sure that the resources that are needed for the city of St. Louis and the St. Louis region are requested and received in a timely manner.
So you don't know yet what those might go to? So you don't know yet what exactly that will go to?
So no, so those are decisions that are made at the state level, but they let us know once after those decisions are made.
Dan?
Yeah, this question's for the mayor and Dr. Eccles. There has been concern nationwide about the shortage of test kits getting to the states to be processed for those who want to get tested. What is your recommendation to the residents of the city who want to get tested now? Are they going to be facing a backlog? Are they going to be facing a gap in getting their information?
Right, so for the resources that are available through the state, I believe they've increased their capacity, and they're working to increase their capacity further over the upcoming weeks as resources become available. Again, for individuals that meet CDC's criteria for testing, those individuals will be able to receive testing through the state departments, so the Missouri Department of Health and Senior Services, and other individuals who do not meet those criteria, they can obtain testing through private laboratories such as LabCorp and Quest Diagnostics.
Kim?
Any estimate as far as how much money we could lose from all these canceled events?
We don't have an estimate of that. We just know that as we see event after event after event cancel, and that includes conventions and sporting events and all the things that I mentioned, those events are very big economic drivers for our city. So certainly we haven't estimated the amount. We don't know it at this time, but it's not an insignificant number.
And then
But it's really important. So the economic impact is important, but we're about saving lives and preventing individuals from becoming infected. So that's our mission and that's our goal at this point in time.
Right, we're just thinking about the businesses, and obviously with the NCAA tournament coming in, this is a huge moneymaker for the city.
It is, but as I said earlier, I mean, it's devastating economic loss and business loss, and all the employees that are not going to work. Yes, that's devastating, but more devastating is to have many, many, many cases of COVID-19. So we made the choice to make the decisions that we believe, that our medical professionals believe will limit the spread.
One more question, sorry, really quick, would be, when it comes to these gatherings, you're banning anything over 1,000. So what does that mean for example, like the Arch or something like that? I know you said schools are not included in this, but buildings that would have 1,000+ people.
Well, this is for events.
Yeah.
So events is a little different than a building that might have 1,000 people working in it, or that sort of thing. So if you have an event, a gala, sporting event, a concert, then we're prohibiting those because those are actual events. But certainly, we can't prohibit more than 1,000 people from being in a building, for example.
No talk of shutting down schools?
No, that's such a complex, not at this time is the correct way for me to answer that, but that's extremely complex and difficult, and the decision there would of course be made by the school district, but it would be made based on what is best for the kids.
And it's important to know that the health department is working really closely with all the academic agencies in the city of St. Louis to make sure they have protocols and plans in place in the event that we do need to take that measure.
I know you mentioned the sanitation stations put downtown for people who may not have access to a sink to do regular washing. Can you talk more about what coordination you're having with homeless shelters and agencies that serve populations that may not have regular access to doctors or places where they can try to protect themselves from the virus?
Absolutely. So we're working really closely with the Department of Human Services, who oversees a lot of the programs for unhoused individuals. And so one step that we're making is, as the mayor mentioned earlier, making sure there are hand washing stations across the city for them that are available for them to use. We've issued guidance to the shelters as well to make sure that they have CDC's latest guidance to make sure they can implement the proper cleaning practices, et cetera.
Did you have a question? That was my question. Okay. Jasmine?
Well, I have a question.
We're gonna do round one and let everybody get a question. Jasmine?
Sorry if you already mentioned this, but are you able to tell us how many tests have been done in St. Louis? And if there's anything being done to get more tests to the city?
Right, so to date, only three tests have been conducted for the city of St. Louis. We have received a special supply from the state in the case that medical providers need testing materials. And so again, this is an evolving situation. As we need additional materials, we'll make sure we will submit our request to the state. We're also working closely with the health system, so as they identify needs, they're communicating that information to us as well.
Since St. Louis doesn't have any cases, is there anything being done to limit travel to and from the city?
So it's difficult to limit travel for individuals that are traveling in their personal vehicles, right? But we are very conscious of the areas that have ongoing transmission across the United States, and so we're making sure individuals are aware of those areas. And so if they can postpone or limit their travel to those areas, we're recommending that as well.
Last round. Nassim?
I was going to ask about contingency plans for any kind of, if it's necessary to release more funding for city agencies like public transportation, et cetera, to purchase more cleaning supplies or do whatever they would need to do to respond to the virus as it develops.
So I need you to repeat that question for me.
I was asking about contingency plans to release more funding if it's necessary for city agencies and public institutions, if they need to buy more supplies or react as things develop.
So within the City of St. Louis Department of Health, so we are monitoring we have a fiscal monitor that's actually looking at our budget to make sure that we can reallocate funds as needed to make sure our first responders have the resources they need. In addition to that, we're working really closely with the State Health Department, and we've already submitted a request for additional resources for the City of St. Louis.
Doctor, how many people are quarantined right now?
So we won't give out numbers. What we will say is that individuals that are under monitoring are complying with us.
May I ask why you won't give out numbers?
We're HIPAA. Because if we give out
HIPAA is about names, not about numbers.
No, HIPAA is about being able to identify an individual, and we are not going to put ourselves at risk for that. So what I will say is that for the region.
I beg to differ. If you say we have 10 people, there's no way for any of us to identify who that is. We just want to know how widespread the
So under our data release policies, standardized data release guidelines, there's a threshold for that. And so for the region, over 20 individuals have been monitored. Individuals have, for the most part, have been compliant. All individuals in the city of St. Louis have been compliant with the protocol, and no individuals have screened positive.
Does that region include St. Charles County or Jefferson County? What's the extent of that?
So when I say the region, that means the city and the county.
Rebecca?
I also talked to Dr. Page right before I came here, and I was asking him about how a lot of people have gone in and said, you know, I feel sick, I'm not sure if I got in contact with somebody, and they're told that the guidelines are very strict about whether or not they can be tested. You either had to travel to Italy or China or come in contact knowingly with somebody. He said, though, and that was largely because the tests were very limited, but he said yesterday those guidelines have changed, and there are now more tests, and there possibly could be more tests going to, as you mentioned, LabCorp and Quest. Have you guys been updated on these new guidelines, and what are they, how are they different than they were before, maybe a week ago?
So the new guidelines, I think you may be referring to, open up private laboratories to actually conduct testing, so individuals that don't meet the CDC's criteria can obtain testing through those agencies. But for the most part, this requirements for the CDC, individuals have to travel to an area, one of the countries that have ongoing transmission. In addition, if they have been in contact with an individual that's a confirmed case, and that's regardless if they're in one of those countries or if they're in the U.S.
But for going to LabCorp or Quest, do you have to have a doctor's note? And
Yes, you have to have a prescription from a physician.
And is the doctor only going to give you that permission if you've gone to China or Italy or been in contact with somebody? Because that's kind of what's been limiting testing previously.
Right. No. So if a physician feels that it's appropriate for their client, although they may not meet the testing criteria for the state, they can issue a directive prescription for them to get testing at a private laboratory.
Just have any symptoms.
All right, we're gonna make time for like 2 more.
Okay.
Jim?
All right. First of all, we don't know, we can't say 10 or 11, but can we say a few, many, or what? That's my first question.
So over 20.
Over 20. Okay, second question. What about worst case? I'm talking about, I don't remember the number, but say in 1918 there were many deaths here. What do we do in a case like that?
So it's also one important thing to remember about that situation was that City of St. Louis had the least, one of the smallest number of deaths associated with that situation because of the measure that they implemented, which included school closures, limiting mobility of individuals across the city. So that is important to note. At this point in time, again, we're monitoring the situation and changing our guidance as needed.
But again, okay, that was Dr. Starklaw's work, wonderful work. And by the way, what do you think about what Dr. Starklaw did? And XML. Let me just get back to the worst case scenario, where dozens of people start dying, which is possible. What do we do?
Right, so part of our emergency operations plan is to actually have plans in place. And so having ongoing communication, not only within the health department, but across all agencies is really important. So as we see things change across the city of St. Louis, we can work closely with our stakeholders and partners to make sure we're providing an efficient response and handling that situation appropriately.
And I guess, Jim, if I could just say, repeat what Chief Jankerson said, which is these are the reasons that we're taking these steps now. The other thing that I would say, I've talked to a few people about this, the world has changed tremendously since 1918. We all travel, we're mobile. It's not the same world. I don't even think they had airplanes in 1918. So it is a different world. It calls for a different response, but nevertheless, it calls for a serious response.
Okay, guys, we're going to wrap up. We've got a lot of people. We've got places to go. We're happy to follow up on the side if you have further questions, okay?
Thank you.
Thanks, everyone.
Thank you all. Don't forget to double check.
You said
your
over 20, is that
surveys.
over 20 quarantine?
Over 20 that have been monitored.
Monitored.
Okay.
You can't say how many have been quarantined. All right. Mayor, this too shall pass.
Oh, yeah.
I want to clarify, over 20 have been tested.